Welcome back to the deep dive. Today, we're navigating a topic that can feel incredibly isolating and, let's be honest, pretty shocking for many parents. What do you actually do when a child starts playing with or, smearing their own poop? The immediate reaction is often just, well, a mix of disgust, confusion, maybe even a bit of panic. But here's the thing we often find on the deep dive. What looks like a challenging behavior on the surface is almost always, it seems, a child's way of communicating some deeper unmet need. So, our mission today is to pull back the curtain on the surprising evidence based reasons behind this behavior, and crucially, to equip you with strategies from expert sources to truly understand and address it.
Exactly. And for this deep dive, we're drawing our insights from some really valuable source material, specifically excerpts from Addressing Fecal Smearing in Children, a parent's guide.
Mm.
And this isn't just like a list of tips. It's a resource grounded in current research and clinical practice. It really helps us shift our perspective, moving away from just seeing a mess that needs cleaning up towards recognizing a signal,
Yeah.
a communication from the child about something they need but maybe can't quite articulate.
Okay, so let's unpack this then. When we look at the research, it becomes clear pretty quickly that this behavior is rarely about simple defiance, right?
Yeah.
So, what are the primary drivers? What are these often surprising reasons behind a child engaging in fecal smearing? What's really going on beneath the surface that we need to understand?
Well, what's often truly counterintuitive for many parents is that, yeah, it's usually not defiance at all. It's more often a child actively seeking intense sensory input. Feces offer a very rich sensory experience. You've got warmth, a distinct smell, a unique texture. For some children, especially those maybe with sensory processing differences, their brain is actually craving specific sensations that their typical environment just isn't inviting. It really shifts our thinking from naughty to needing. And the really good news here is that sensory substitution, like offering warm Play-Doh or putting maybe even scented lotions, can be a really helpful intervention. It meets those sensory needs in a safe, acceptable way.
That's a really eye-opening perspective right off the bat. So if it's sensory driven, does that mean we might inadvertently be increasing the behavior if we just try to stop it without addressing the underlying sensory need?
Exactly. Without an acceptable alternative, the child might just continue to seek that intense input in the only way they know how. And beyond that, we often find medical and digestive factors at play too. Constipation or other gastrointestinal discomfort is, well, it's strongly linked to fecal smearing. Chronic constipation, for instance, can cause overflow soiling or just general discomfort, and a child might smear in response to that internal feeling. This is why keeping a careful record of stool patterns, maybe even using something like the Bristol Stool Form Scale, which is basically a simple chart, helping you and your doctor understand stool consistency can be incredibly important. It helps physicians pinpoint any underlying medical issues. Then there are the significant behavioral and emotional drivers. Smearing can absolutely be a form of attention-seeking behavior. And here's where it gets kind of tricky. Even negative reactions from parents, anger, upset, frustration, that still counts as attention. Any strong response can inadvertently reinforce the smearing if the child feels ignored or isn't getting enough positive attention at other times. And furthermore, it could be an expression of distress or maybe a bid for control. This is particularly true for children with conditions like autism, ADHD, or maybe a history of trauma. When their verbal or emotional regulation is limited, smearing can become a powerful, albeit undesirable, way to communicate frustration, discomfort, or even just to regain a sense of agency.
I can just imagine a parent hearing attention seeking and thinking, but I do give them attention. How do we sort of differentiate between typical attention and the kind that might accidentally reinforce this specific behavior?
That's a really vital distinction. Often it's about the quality and the timing of the attention. If a child gets this really intense, even if it's negative, attention only when they engage in smearing, well, that reinforces the behavior, doesn't it?
Right.
The goal is really to flood their world with positive attention for appropriate behaviors and make the attention for the smearing as neutral and brief as possible. And often these behavioral and emotional elements are deeply intertwined with neurodevelopmental factors. Autism and sensory processing differences are very common contributors here. Research highlights that something like 86% of children with autism have sensory differences. And smearing frequently co-occurs with these sensory needs or maybe difficulties in communication. It's often part of a broader picture of how they experience and interact with the world.
That brings up such an important point. If this behavior isn't just random, then what exactly are these children trying to communicate or achieve? Could you help us kind of consolidate those core underlying needs?
Absolutely. Let's try and boil it down. When a child engages in this behavior, they are typically trying to communicate or seek one of, say, four things. First, sensory input, the unique touch, smell, texture they might not be getting elsewhere. Second, they might be seeking attention, especially if they're feeling lonely or bored, perhaps experiencing emotional neglect, and this is just the most potent way they've found to get a reaction. Third, it could be a cry for relief from discomfort, whether that's medical, sensory, or emotional, when they simply lack the words to express it. And finally, particularly for children facing developmental or emotional challenges, it can be an attempt to gain a sense of control or maybe to express deep-seated anxiety or distress in a way that feels powerful to them.
Okay. So, with this foundational understanding of the why, I imagine parents are now really eager for the what to do. Let's shift our focus now to the concrete, evidence-based strategies that can truly make a difference here, because understanding is the first step, right? But action is where we actually make progress.
Absolutely. And the first, arguably the most crucial step, is to rule out medical causes. You absolutely need to have a pediatrician evaluate for constipation, any GI issues, or pain. Addressing any underlying medical discomfort can often significantly reduce, sometimes even eliminate, the behavior. It's really the foundational piece. Okay, so once medical issues are addressed or ruled out, it's vital to track patterns. Keep an observational log. Note the timing of incidents, where they happen, your child's mood before and after, what might have preceded the smearing. It helps you understand potential triggers. Is it boredom, stress, sensory deprivation? It's kind of like being a detective for your child's behavior. And as we discussed, if it seems sensory-driven, provide sensory alternatives. Offer safe substitutes that mimic those desirable sensations. Think warm Play-Doh, pudding, scented lotions, maybe various textured art materials. The goal is meeting those sensory-seeking needs without involving feces.
Right, almost like a child's version of needing a fidget spinner, but, well, yeah, with a much messier outcome if it's not channeled appropriately.
Exactly. And critically, respond mindfully. This means really trying to avoid overreacting or giving intense negative attention. Instead, aim to stay calm and redirect the child. And make sure to praise alternative, acceptable behaviors, like when they do engage with the sensory materials you provide. It's tough in the moment, I know, but that calm response is really key.
Yeah, it sounds incredibly challenging to stay calm when you walk into that kind of situation, but it makes so much sense that an intense reaction could actually make things worse in the long run. What about more structured support if things are really persistent?
Right. For persistent behavior, it's often helpful to use structured behavior plans. A functional behavior assessment, or FBA, which is essentially a systematic way to figure out why a child is doing what they're doing. That's incredibly valuable here. It helps identify the specific purpose or function behind the smearing, allowing you to then create a behavior intervention plan that teaches your child alternative, appropriate ways to communicate or get attention. This often ties into approaches like applied behavior analysis, ABA, which focuses on teaching new skills and reducing problematic behaviors by understanding their function. And if communication is a barrier, maybe especially for children with speech delays or autism, support communication. Introduce augmentative communication tools, perhaps visual supports or social stories. These can give children safer ways to express discomfort, boredom, or anxiety, reducing the need for smearing as a way to talk. Also, a practical tool for some children is adaptive clothing. Things like restrictive clothing or protective garments can sometimes buy caregivers crucial time to intervene and prevent smearing in high-risk situations. It gives you that little window to redirect or address the underlying need without the immediate mess. And finally, please, don't hesitate to seek professional help if the behavior persists. Pediatricians, occupational therapists, behavioral analysts, especially those specializing in ADA developmental specialists, they're all experienced with sensory and self-stimulatory behaviors. They can provide tailored guidance and support when you feel like you're hitting a wall. It's understandable for parents to feel overwhelmed, even, disgusted sometimes. But the good news, and what the research consistently shows, is that there are very clear, actionable steps.
That's an incredibly practical toolkit. And what I'm hearing, sort of as a common thread across all these strategies, is this profound shift. Moving away from merely reacting to a problem and towards proactively understanding a communication. Am I tracking that correctly?
Absolutely. That's it exactly. It's about seeing the behavior as information, not just an undesirable action. And before we wrap up, it's probably crucial we address some common myths and concerns that often pop up around this sensitive topic. What should we clarify for our listeners?
Yes, definitely. There are some misconceptions out there that can really add to a parent's distress. Let's tackle those head on.
Okay, first, let's clearly differentiate between pica and smearing. Pica involves ingesting non-food items consistently for over a month. Smearing, by contrast, is about touching and spreading feces. They are not the same thing unless, of course, ingestion also occurs, which tends to be less common with just smearing behaviors. Right. And the second clarification, this is a really important one, concerns the implication of abuse. There's this persistent and frankly harmful myth that fecal soiling or smearing is somehow a reliable sign of sexual abuse. The research, however, indicates this just isn't true. One study found that soiling had roughly a 45% predictive value for abuse, compared to a higher rate, around 63%, for specifically sexualized behaviors. Crucially, children with psychiatric issues often showed similar rates of smearing as abused groups did. What this means is that soiling alone is not diagnostic of abuse, clinicians, caregivers. We should first consider broader psychological or medical causes before jumping to such serious conclusions. It's vital not to conflate the two.
So really, at its core, children who play with or smear poop are usually signaling some kind of unmet need, sensory, medical, communication, or emotional. They're generally not simply acting out, being defiant, or, maliciously trying to upset you. Understanding the why is what empowers us to respond with empathy and strategy rather than shame or punishment.
That's such a critical takeaway. So if you're navigating this, the message seems to be start with medical and sensory inquiries, meticulously track when and why it happens, offer appropriate alternatives to meet those sensory or emotional needs, and actively work to promote communication skills. And remember to stay calm, stay consistent, and be collaborative with professionals. With time and supportive strategies, this behavior can be greatly reduced and replaced with safer, more effective ways for a child to express themselves and engage with their world. And maybe, as you reflect on this deep dive, consider how this profound understanding of a child's unspoken needs might prompt you to look differently at other challenging behaviors in life, whether in children or even adults. What if, instead of just reacting to the surface action, we consistently sought the underlying communication or unmet need? What could that shift in perspective unlock for us all?